Hello everyone, and thanks for listening today. This is the RX Daily Dose. Today's episode is being recorded on Friday, November 22nd, and I'm your host, Ian Parnagoni. We update this podcast every week for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all of your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. So there's a lot to catch you up on, so let's get right into it with updates from the FDA since we last were up. The FDA on November 8th approved luspatercept, going by brand name Reblozyl, for patients who have beta thalassemia, an inherited disorder that leads to anemia, or low levels of oxygen-carrying red blood cells. Beta thalassemia patients require regular blood transfusions to keep their red blood cell levels up. Those transfusions can lead to a buildup of iron, which can damage organs. The excess iron must be removed by additional therapy. Celgene and Acceleron developed Rebloyzl to regulate the late-stage maturation of red blood cells, boosting the production of these cells in patients who have rare types of anemia. The drug, which is given as a subcutaneous injection, is intended to reduce a patient's need for blood transfusions. Rebloyzl's approval is based on data from Phase 3 trials that showed the patient group treated with the drug had a greater than 33% reduction in red blood cell transfusions compared to a 4.5% reduction in the group given a placebo. The most common side effects included headache, bone pain, and joint pain. More serious side effects, such as deep vein thromboses and an ischemic stroke, were reported in 3.6% of patients treated with Rebloyzl. Abnormally high blood pressure was reported in 10.7% of treated patients. The FDA's approval of the drug comes about 3 weeks ahead of the December 4th target date for the decision. The two companies will co-promote the drug in the U.S., and they expect it will become available shortly. Celgene and Acceleron aim to broaden use of Rebloyzl to other types of anemia. They have filed for FDA review of the drug as a treatment for anemia in patients who have myelodysplastic syndrome, which is a disorder that leads to red blood cells that are abnormally formed or poorly functioning. An FDA decision for that use of the drug is expected by April 4th. The drug is also in mid-stage testing as a treatment for myelofibrosis, which is a rare type of bone marrow cancer that disrupts red blood cell production. The FDA also this week granted an accelerated approval to zanubrutinib, that's brand name Brukinsa, for the treatment of adult patients with mantle cell lymphoma who have received at least one prior therapy. Mantle cell lymphoma is a type of non-Hodgkin's lymphoma and represents about 3 to 10% of all non-Hodgkin's lymphomas in the U.S. That's around 3,000 to 4,000 new cases each year. The approval is based on findings from 2 trials. The first trial was a single-arm, open-label, multi-center Phase 2 trial conducted in China that included patients with relapsed or refractory MCL who had received 1 to 4 prior therapies. Patients were given Brukinsa 160 milligrams twice daily until disease progression or unacceptable toxicity. The primary endpoint of the study was objective response rate by an independent review committee using PET-based imaging. According to findings presented at the 2018 ASH annual meeting, the objective response rate was 83.5%, with a complete response rate of 58.8%, as the best response and partial response in 24.7% among 85 evaluated patients. The most common side effects included decreased neutrophil count, upper respiratory tract infection, rash, decreased platelet count, and decreased white blood cell count. The second trial demonstrated tumor shrinkage in 84% of patients and had a median response duration of 18.5 months. The FDA also noted in its approval that patients treated with Brukinsa should be monitored for hemorrhage, signs and symptoms of infection, cytopenias, and cardiac arrhythmias. Additionally, there is a risk of other malignancies, including skin cancers, related to treatment with Brukinsa, so the use of sun protection is encouraged. Previously this year, the FDA had also granted the BTK inhibitor with a breakthrough therapy designation in the same setting, and the agent has also received an orphan drug designation. The FDA also approved cefiderocol, going by brand name Fetroja, for the treatment of patients age 18 years and older with complicated urinary tract infections. The drug is indicated for patients with limited or no alternative treatment options for complicated UTIs, including kidney infections caused by susceptible gram-negative bacteria. Dosage is 2 grams every 8 hours, administered by intravenous infusion over 3 hours. Dose adjustments are required based on creatinine clearance. Approval of Fetroja was based on safety and efficacy data from 448 patients with complicated UTIs in the APEX CUTI study. 7 days after treatment completion, symptoms resolved and bacteria were eradicated in 72.6% of patients who received Fetroja versus 54% who received imipenem cilastatin. Clinical response rates were similar between the two groups of patients. Labeling for Fetroja includes a warning regarding the higher all-cause mortality rate observed in Fetroja-treated patients compared to those treated with other antibiotics in a trial in critically ill patients with multi-drug resistant gram-negative bacterial infections. The cause of the increase in mortality has not been established. Some of the deaths were a result of worsening or complications of infection or underlying comorbidities. The higher all-cause mortality rate was observed in patients treated for hospital-acquired ventilator-associated pneumonia, bloodstream infections, or sepsis. The safety and efficacy of Fetroja has not been established for the treatment of these types of infections. The most common adverse reactions observed in patients treated with Fetroja included diarrhea, constipation, nausea, vomiting, elevation of liver tests, rash, infusion site reactions, cough, headache, and low blood potassium. Fetroja should not be used in individuals with a known history of severe hypersensitivity to beta-lactam antibacterial drugs. The FDA also approved crizanlizumab, going by brand name Adakveo, for the reduction in frequency of vaso-occlusive crises in patients at least 16 years of age with sickle-cell disease. Adakveo is currently the first and only approved biologic that works by binding to P-selectin, which is a cell adhesion protein that's involved in multiple cellular interactions and can lead to vaso-occlusion in sickle cell disease. By binding to P-selectin on the surface of an activated endothelium and platelets, Adakveo blocks interactions between endothelial cells, platelets, red blood cells, and leukocytes. Considered the clinical hallmark of the disease, sickle cell patient crises are triggered in part by multicellular interactions that form clusters of cells, which can block or reduce the blood flow to organs. Sickle cell pain crises can be frequent and sudden. They are associated with an increased risk of life-threatening complications. They are also the main reason why individuals living with sickle cell disease go to the emergency room and are admitted to the hospital. There are around 100,000 people in the U.S. living with sickle cell disease. And just thinking about that for a minute, because your red blood cells carry oxygen everywhere, think of all the things that are affected and what could happen. Stroke, vision loss, blood clots in the lungs, and infections are just some of the life-threatening complications that may result. Until now, there haven't been any specific ways of preventing such crises, aside from drinking plenty of fluids and avoiding situations that may be triggers, such as high elevation, extreme cold, physical exhaustion, and certain drugs like acetazolamide. Vaso-occlusive crises certainly can occur despite these precautionary measures, and treatment of such crises has mainly involved giving pain medication, hydration, oxygen, and blood transfusions. The approval comes after a randomized clinical trial with 198 participants showed that patients who received Adakveo had fewer healthcare visits for vaso-occlusive crises each year than those who received placebo. It was actually 1.63 versus 2.98 visits, and had a longer time until experiencing their first vaso-occlusive crisis during the study. That's 1.4 versus 4.1 months. In fact, over a third of those patients being treated with Adakveo didn't even have any vaso-occlusive crises during the study. Common side effects for patients taking Adakveo were back pain, nausea, pyrexia, and arthralgias. Healthcare professionals are advised to monitor patients for infusion-related reactions and to discontinue Adakveo for severe reactions. Patients who receive Adakveo should be monitored for interference with automated platelet counts or platelet clumping. Healthcare professionals are advised to run tests as soon as possible or use citrate tubes. The FDA also approved cenobamate, going by brand name Xcopri, to treat partial onset seizures in adults. A seizure is usually a short episode of abnormal electrical activity in the brain. Seizures can cause uncontrolled movements, abnormal thinking or behavior, and abnormal sensations. Movements can be violent at times, and someone having a seizure can be in and out of consciousness. Seizures occur when clusters of nerves in the brain undergo uncontrolled activation. A partial onset seizure begins in a limited area of the brain. The safety and efficacy of Xcopri to treat partial onset seizures was established in 2 randomized double-blind placebo-controlled studies that enrolled 655 adults. In these studies, patients had partial onset seizures for an average of approximately 24 years and median seizure frequency of 8 seizures per month during an 8-week baseline period. During the trials, doses of 100 milligrams, 200 milligrams, and 400 milligrams daily of Xcopri reduce the percent of seizures per month compared with placebo. The recommended maintenance dose of Xcopri following a titration period is 200 milligrams daily. However, some patients may need an additional titration to 400 milligrams daily, which is the maximum recommended dose based on the clinical response and tolerability. Drug reaction with eosinophilia and systemic symptoms, also known as DRESS, has been reported among patients with Xcopri. In the clinical trials, some patients experienced DRESS and one patient died when Xcopri was titrated rapidly. No cases of DRESS were reported in an open-label safety study of 1,300 epilepsy patients when Xcopri was started at 12.5 milligrams per day and adjusted every 2 weeks. However, this finding does not show that the risk of DRESS is prevented by a slower titration. Also, a higher percentage of patients who took Xcopri had a shortening of the QT interval of greater than 20 milliseconds compared to placebo. Xcopri should not be used in patients with hypersensitivity to cenobamate or any of the inactive ingredients in Xcopri, or familial short QT syndrome. QT shortening can be associated with VFib. And also, anti-epileptic drugs, including Xcopri, increase the risk of suicidal thoughts or behavior in patients taking these drugs for any indication. Patients taking a seizure med for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and or any unusual changes in mood or behavior. Xcopri side effects include sleepiness and fatigue, dizziness, trouble with walking and coordination, trouble with thinking, and visual changes. Patients should also be advised not to drive or operate machinery until the effect of Xcopri is known. And that's all I have for this week. I hope you enjoyed today's episode. I'll include all links and resources in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you listened to today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. I hope you enjoy the rest of your day. Music by Joseph McDade.